Welcome to Reveal AI in Healthcare, a webinar series where we explore the emerging landscape of AI in the healthcare context. Today, I have the privilege of having Dr. Daniel Nigrin with us, who is a physician first, pediatric endocrinologist who's entered the technology world. And he is currently the CIO of the largest health system in New England, Maine Health.
Northern New England, Sal.
Northern New England.
Otherwise, my colleagues at Mass General Brigham will start coming after me.
Absolutely. Sorry about that. Just want to take a moment, though, to acknowledge the context of today's call, and I really appreciate having this call. In the past 12 hours, there's been an awful tragedy in Lewiston, Maine. A active shooter situation is still ongoing. 22 lives have been lost. 60 people have been injured. And Maine Health is I'm sure, the primary health system serving these patients. Our condolences and deep empathy to those in the community. And I want to take just a moment of silence. Dan, as a doctor, you've taken care of so many patients. In this context of today's events and suffering, is I'm sure at the base of why I'm doing my work and why you're doing your work. And I would just love for you to kind of just start talking about, the nature of your responsibility of serving the 1.5 million or so people you care for. And the responsibility of having a health system that can respond and can serve the community.
Yeah, Sal, thank you first for acknowledging what's happened last night. The last 12 hours have been a bit of a blur for us here. It's certainly not something we're accustomed to, here in Maine and New Hampshire. It's not routine for us. It's not routine for anyone, for sure, but in particular for this part of the country where things are a bit more idyllic. Folks don't lock their doors as a routine. It's certainly a difficult and new experience for folks here. All I can remember, and it's funny how the feelings are very much the same. I remember back to my days in Boston when the Boston Marathon bombing occurred, just less than a mile away from our facility, and the anxiety and all hands on deck kind of feel that you get as a healthcare organization, and very similar feelings throughout this episode so far. The facility, Central Maine Medical Center, that is receiving most of the patients, is actually not part of Maine Health. They're part of a different health system, but we're close partners together with them. We did, in fact, receive some of the patients at our Maine Health facilities here in Portland. But yeah, it's just we're here to be as supportive as we can, obviously for the people directly involved, but for all of the members of the community. And we're doing all that we can to be that supporting organization, and just wrestling with the realities that each of us face every day in this world that seems crazier by the minute. So it's a difficult time, but we'll get through it, and hope that the families that are suffering find some solace in the future.
Absolutely. It makes me think about, I've known you for some time, and, we've gone through some tests together, from the bombing in Boston to cybersecurity attack that we've experienced. And, we all have different roles to play, and you've had a unique role as a CIO to not only mitigate these dangers, but then also to respond and lead. And as we're entering this new landscape of AI being built and this increased threats of cybersecurity, just this week in Southern Ontario, hospitals have been attacked and they're down. There's 5 hospitals in the whole region in Canada. I'd love for you to kind of talk about what are the pieces that you do that you establish among your team from a governance standpoint, and how do you think through being prepared around this?
Yeah, well,
threats.
for sure. In the cyber attack event that you referenced, clearly IT is front and center in the midst of those. But beyond those, for any sort of mass casualty event or any sort of stressor on a big health system, IT inevitably plays a large role because we drive the supporting systems that allow our clinicians to provide the care that they do. Clearly, having all of those systems at the clinician's fingertips, doing what they're meant to do, facilitates their jobs, and in many ways can help them. In situations like a triage kind of situation, when you've got 50, 60 casualties, and some of them, in really an extreme state, coming in all at once. Those are times when technology can help to alleviate some of the strain and to get those patients to where they need to go most expeditiously. So we're clearly not at the very sharpest end of the spear when it comes to these events. That's the role for our clinicians. But that by no means implies that the role that we play is not a critically important one as well. In fact, it can be just as important, because making sure those systems are there and helping our colleagues do what they need to do to care for the families and patients that come in, that's part and parcel of what we've got to do as well. So it's again, I'm not thrilled about experiencing a new one of these in my career, but we'll do what we need to do. And as I said, we'll get through this one as well.
There's a couple of things you've mentioned here. For those in the front line, the expectation is the other things will just work, right? So then you have the responsibility for things to be durable and sustained, right? And not to crumble under pressure, under load. How do you balance, on one end, being conservative and making sure the system is solid, but not tinkering too much with it, with now all the opportunities that exist from AI, ChatGPT, and how do you not become so conservative that you're not adopting technology that can benefit people because of fear of risk versus becoming super vulnerable? Yeah. Can you just share a little bit of how you're leading that and what your thought is from a health system standpoint?
For sure. Yeah, and you're absolutely right, Sal. The promise of AI is upon us, right? And it's very interesting. Unlike many buzzwordy kinds of trends that we've seen together within our healthcare IT journeys, you and I, this one seems like it's got substance to it. I'm a strong believer that these tools that we're seeing now, these technologies, are really going to make a difference to the way that you and I practice medicine, and all of our colleagues as well. And even more than that, all of the administrative aspects of healthcare are also similarly going to be impacted. And I say impacted on purpose. I think that most of them will be positive. I'm sure we'll have some negatives along the way too. But the bottom line is that this is real now. And I absolutely think that healthcare systems need to lean in on this and not be so frightened by it and say, you know what, we're going to crawl under a rock for 5 years. You guys go figure it out, and we'll maybe implement some of these things down the road. I think that's the wrong approach. So to your point, how do you do that without risking, the whole health system along the way? And I think the answer is to just do some testing in really controlled pilot kinds of proof of concept scenarios where you're not risking the entire system. You're experimenting in a controlled way, just like you would for a research endeavor, applying a new therapy for a patient. You do it in a controlled manner with clear guidelines, clear exit strategies if things are not looking promising, and you see how you do. You look at your outcome variables, and if promising, then you start to expand. And if really promising, well, then you start to apply towards the whole health system. So in many ways, I view it the same as when we're evaluating new therapies for patients. I see this as a new tool in our healthcare tool belt, if you will. And we've just got to test and evaluate as we go, and being careful as we do those.
One of the things I think is different, though, is now everyone is talking about it. See, in the past, when we used AI in pathology, or it was contained within a certain group of specialists, and we'd apply it in that context. But now everyone is talking about ChatGPT and large language models. And what I found over the past year is I would ask people, what are your concerns? And there'd be a whole range of concerns that people would put out, from job displacement to privacy to AI systems taking over. And one of the concepts that I've been thinking about is, how do we build a process where we build unity of thought that leads to a vision that leads to action? And at institutional level, how do you go about doing that? Have you been thinking through because it's about educating everyone, from the nurses and doctors to the community itself. If we want it to be sustainable, for it to be adopted, and we also need the technology partners, companies, to also be involved. So I'd love to hear your thoughts around that.
Yeah, it's a tall order, and your point about everyone talking about it is absolutely true. I mean, and I think that's because these technologies have now found their way into people's ordinary lives, right? You can ask ChatGPT to do anything for you. You can reply to a friend, a colleague with a summary of what you want to say, and have ChatGPT draft that for you if you couldn't quite find the words, to optimizing your recipes in the kitchen, to whatever. And so because of that insertion into people's everyday mindset, they appropriately think about, well, gosh, how could I translate some of that way of thinking, way of working into my healthcare role? And so it's understandable why it's more top of mind, I think, for many folks within the healthcare space. Within our organization, we've tried to establish some high-level governance principles and groups around how we're going to manage AI. Because again, to your point before about it being so new and potentially risky in some instances, we need to have some structure around how we make decisions for ourselves. What are the applications that we're going to test and begin to roll out? Where do we want to be that more cautious organization to let others do the experimentation first? And this is not just clinicians. This is not just C-suite leaders. This has got to be a broad representation throughout your organization, because I really think that AI, like I said before, is going to touch all aspects of our organization. So it does include clinicians, doctors, nurses, APPs. It does include administrators, but it also includes our legal counsel. It includes ethicists. It includes representation from our human resources department. When people are worried that they're going to lose their jobs because of technology that we roll out, well, we need to be ready for those kinds of questions. And in instances where people's roles are going to change significantly because of technology, we need to be ready to guide those folks to augmenting their skills in other ways so that they can remain gainfully employed in our facilities. We've even started to engage patient representation on these governance committees, so that we've got that perspective as well. Researchers, for sure, included, and even some outside sort of more facile with the actual technology. Some artificial intelligence experts from academia, from organizations that we're affiliated with. So we've tried to bring together all of these people to help us evaluate and come up with a framework that we're going to use to make decisions moving forward. We're still in our infancy. We've met 2 or 3 times, I think, already. It was only set up over the course of this past summer. Obviously, all of these things are only 9 months or so in, really, from the advent of ChatGPT. At least in common practice anyway. So it's all going very fast. I think that's the other difference that I've seen compared to previous, new tech that's come our way, is the tempo. It's just mind-boggling how quickly things are moving. Even just evaluating commercial partnerships with vendors that you mentioned just before, that landscape changes by the month. There's a new startup. There's a new application that one of our established vendors is working on. So it's almost a full-time job just keeping up with those.
It's funny because when I first met you, I had come in with a very, I came from startup side of the world, starting developing products, and it was only over time I developed deep empathy from an enterprise perspective. Responsibilities, right? And I'm going to touch on this topic here, which is outside of everything you talked about, is the legal side, right? The responsibility of who is actually responsible for an algorithm, for an error. I know in September, IBM came out with a statement saying they're going to underwrite and ensure to take the responsibility from an algorithm standpoint, and also be transparent regarding the data that is used to train their models. And I thought that was a huge shift, because up to that point, it's always been the end user, the physician, is responsible for whatever tool you use, right? And, it is a black box at the end of the day. It's very difficult to also monitor. How often do you monitor? Once a month? It could be drift that occurs, right? So once, it may have worked well for the first 6 months. I'm wondering on that side, we are monitoring legal responsibilities, BAAs, and I know it's early, but I kind of want to talk about it because I think a lot of people forget the magnitude of responsibility and the legal kind of challenges that exist in that space.
Yeah, for sure, Sal. There's a lot of ways I can take this comment. For one, the risk aspect of things, right? The legal liabilities are huge. In the broader AI world, in particular around the large language models, there's all of the discussion around intellectual property and how those are secured, and litigation that's coming about because of that. I think the IBM announcement was interesting in that regard. But there's obviously within our world, within the healthcare world, there's all kinds of other concerns from a liability point of view. What happens if the AI-based tool spits out the wrong conclusion and leads the clinician down an errant path and mistreats the patient? This notion of deploying technologies that always include a human in the loop. It's a phrase that you start to hear quite a bit of now, I think is absolutely critical, especially at this early stage of our learning around these technologies. Making sure that human being who's got the knowledge base can interpret what's being advised by the tech, and making sure that there's a sanity check, along the way. and not being like the lawyer that's featured in all the news stories who did their summary case only to find out that most of the facts were hallucinations based on the LLM. Let's not be that example within healthcare. So there's that concern. There's also a lot of concerns around the ethics that come into play when dealing with some of these algorithms. How are those algorithms trained? What were the data sets used within their development? Are they appropriate for the patient population that I'm about to use their findings on? So this notion of understanding how the tech was built, even if you don't fully understand what's inside the black box, I think it's worth an exploration to at least get a minimal understanding of what went into the building of that algorithm. There's a whole lot of discussion in the field around explainability of some of these excuse me, technologies, and I think for better or worse, we're likely not going to be able to explain a bunch of them. And so we're going to need to find some comfort level with that, but also making sure that we've got some boundaries, right? We've got some understanding of what went into building it. I should pause and say, I apologize if you can hear there's some leaf blowing outside. So Sal, let me know if that's the case and I'll move somewhere else.
I think it's okay. I'll wait for our team to say if we need to do that.
Okay.
So there's two things I've been thinking about. One is, so when you sign, so say you have a company and you sign with a health system, you usually sign a BAA, right? A business association agreement, where you are agreeing to security standards, right? And a whole range of things. I'm wondering, one thing I have not seen, and maybe it exists, is a BAA statement around non-discriminatory practices now in regards to the algorithms being developed, right? So if you imagine, you could build systems that are biased towards optimizing scheduling for those with better insurance or those who are more likely to show up, and it will shift access, right? And I think that discourse regarding not using the methods that exist in commercial marketing, right? We know that the pricing can be adjusted on Amazon based on the kind of computer you're using, your zip code. Well, we can take those same methods and give optimized scheduling to predict people who are more likely to show up on time, who have better insurance, better co-pays, and so forth. Have you seen movement in that space for responsibility to be held by both parties?
Yeah, this is, first of all, just a short answer to the question is, I don't think we've really seen, sorry, I'm just going to move because I am getting a signal that some folks can't hear well. I don't think we've really seen this emerge yet in any of the legal relationships that we've got with these companies. I've not seen a BAA that includes these kinds of measures in place or protections so that these companies don't do these sort of tactics. But I would not be surprised if we try and see some kind of legislation emerging in this space, because you're right. It's so ripe for badness to happen. And as much as I have faith in humanity, there are always some bad actors out there who will try and game the system a little bit to their advantage. And that, ultimately is not what we want. So, but it's still such early days that I don't think we've started to see these kinds of things emerge in the legal relationships yet with corporate partners.
I always like to talk about. I find myself that as we talk about these risks, we all naturally start to become more conservative. But I like to oppose that with the reality that today's health systems, though, are also flawed, and that a lot of people are suffering unnecessarily because of errors, because of lack of access. And the potential of AI to actually overcome those issues is huge. So the risk of not doing anything is also great. And I think that's a really important thing to balance and to have that dialogue. And this is why I think having nurses and clinicians involved and patients involved themselves to talk about how it works. Real quick, I remember as a resident coming into one of the hospitals in Boston as a rotation, and they said, "Oh, we need you to go downstairs and do like 150 discharge summaries." And I went downstairs, and there's stacks and stacks of files. And I had to summarize basically through this. And today with like chat, with a large language model, it could definitely be more accurate and better than an intern who's overworked, who's doing it in between, OR cases.
Yeah.
It's so much of our healthcare system, we have processes that are flawed that lead to bad outcomes. And I think that's important to kind of balance.
Yeah, completely agree, Sal. The same kind of discussion as with self-driving cars, right? The argument, well, gosh, they're not perfect. They got into an accident. They just got shut down in San Francisco, I saw, for the taxis or whatnot. But what's the flip side? The flip side is you got human beings who are clearly far from perfect in that area, and which is worse. And I think the same sort of cost-benefit kinds of discussions will need to occur within healthcare. And obviously, there's some areas where we can be a little bit riskier, right? Especially in ones that are not directly related to the provision of care. So maybe ones around the more administrative aspects of what we do. But still, even within the care provision, I think clearly we've got areas of opportunity there where it's likely that the technology will do better than the human alone. So we'll need to weigh those risks and compare the benefits and proceed accordingly. But I think, like I said up front, burying ourselves, sticking our heads in the sand is not the way to approach this. We've got to approach it carefully, for sure, and in a stepwise manner. But it's here, and I think it's a very useful opportunity that we need to take advantage of and not be scared of.
So, for those hospitals that are in the community that are listening, what is your framework for use cases? If they're going from 0 to 1, what is your recommendation of how to? Because it's a learning process, right, for the entire community. So, is there a certain framework in your mind regarding use cases that are the best to start with, and then start building that capacity internally?
Yeah, I'll be very frank. We started this journey, if you will, back in the spring, where we started to talk internally around, well, what could we use these new technologies for? What are our pain points that maybe these AI algorithms would help us with? And again, the speed of development is unbelievable. Just as we were starting to ramp up to do some self-development and work on these things ourselves, lo and behold, you hear about vendor X, Y, and Z also doing the same thing. And, they've got way more resources than we do. And so we, quickly shelved our internal project in lieu of instead letting our vendors work on it. So that's happened actually 2 or 3 different times. We were thinking about the current challenges with providers and in-basket messages. One of the new scourges in a post-pandemic world where providers are just inundated with patients communicating with them via secure messaging on portals and whatnot. And so that was one of our first target areas. And lo and behold, our EHR vendor is working on that exact solution where the tech will propose a response to a query using information from the patient's chart and using just general knowledge about the issue that's being asked about. Obviously, again, human in the loop, not sending that directly, but proposing a draft for the provider or the APP or the administrator, whomever, to review. So again, fantastic use case. So we're just approaching them one by one. We're not We're not chasing shiny objects. We're not looking at all costs to implement technology. We're trying to define what our biggest challenges are right now, and then looking to see if any of the new AI developments seem like they would be suitable for addressing those challenges. And in many instances, they're starting to be, which is great.
In evaluating these use cases, what is the balance between the financial impact, right? So the ROI on the investment, to say the impact on morale for our clinicians? Are you looking for faster ROI, but not as high magnitude and higher? Like, I'm just curious, how are you balancing this in the discussions? Because the reality is a lot of hospitals are on a massive strain, both on the human resources and as well as the margins.
Yeah, I think the answer, Sal, depends on the use case. So again, let me bring up that in-basket one. That's going to be a little bit tougher to quantify, right? Like if I save the clinician from an hour's worth of pajama time when they get home, and they can finish their tasks by the end of the normal workday, that doesn't really save me any direct dollars. So there's no immediate financial ROI, but maybe there's an indirect ROI, right? Because that doc's not going to retire 3 years early out of frustration. That won't require me to go hire a new clinician in their place. It won't have me lose the revenue that clinician would have generated once they've retired and before I hire the new person. So there's clearly some indirect ROI there, much tougher to quantify. And so in those instances, I think we're really looking at the the subjective benefit, the feedback that we would get from those clinical providers about how appreciated this technology is and alleviating some of the strain that they had. But the flip side of the coin is that there are some really real savings that we might appreciate. So maybe that's using AI in our call center at answering telephones, and in being able to either triage the patient to the right location within our health system, or in some instances maybe even accommodating the caller's request just with technology alone and not involving a human at all. Clearly, that's going to have some direct ROI, financial ROI, in terms of the number of staff that we need to man that call center. Very, very direct savings that we could model and measure and attribute to the technology. So I think there's going to be a spectrum, and it's going to depend on the instance that we're talking about. But for sure, to your point, health systems around the country are in no place right now to be squandering money. We're all hurting again in the post-COVID environment from a financial perspective, and so we can't just willy-nilly just throw these tech pieces within our organizations without scrutinizing them to be sure that we're appreciating the benefit that we expect from them.
So, just a couple of weeks ago, there was the health conference in Las Vegas, 15,000 people, thousands of companies. And you sit there, responsible for Maine Health, and you have some core vendors that are across your institution. And then you have thousands of companies doing really exciting work. And you also have your own team. And earlier we alluded to you were building internally and then decided to work with one of the vendors. What is your framework of thinking regarding the big boys that your main vendors versus this emerging landscape? How do you think about partnering with them or doing pilots with them?
Yeah.
And what are your suggestions for them to be most effective to accommodate your needs?
Great question. And I wish I had the magic answer, because honestly, this is one that we're still figuring out. And I think a lot of organizations are too. What we're doing, and again, I know what a lot of my peers are doing, is first we tend to look to our established vendors, whether that's in the ERP space, whether it's in the clinical care space with our EHRs, because it's just far easier to integrate these new technologies into the core systems if they in fact are being developed by those core vendors. They tend to work better. They certainly have access to all of the other data that they likely need to do their job. So when we're trying to solve a problem, that tends to be where we look first. And that's very true for all of these new AI technologies as well. And to their credit, many of these vendors are hard at work on a lot of different ideas, and are starting to roll these things out, and some of which we're already taking advantage of. However, they're big vendors, and like big anything, they tend to have a bit more inertia, and they're a bit less nimble than a smaller organization like a startup might be. And so because of that nimbleness, we do see some examples where the smaller organizations are bringing things to market that are potentially complementary to what we're seeing coming from our bigger, more established vendors. And so I don't want to paint a picture, if there's any smaller vendors who are listening, that you know, the outlook is bleak. I think, if anything, the exact opposite. But you're going to need to be very fast on your feet. You're going to need to have a good sense of what the established vendors are doing and what they're not doing, and then help to fill those gaps where they're not doing things, and have those innovative new ideas. Now, sifting through those 1,000 vendors that you alluded to at Health or Vive or whatever conference you want to talk about, that's a challenge. And again, I wish I had the silver bullet answer for that. But bottom line, I do think there's a place for some of these more niche, agile folks to find their way into organizations, and to be complementary to the tools that we're getting from the bigger organizations. And then finally, for self-development, I think, again, along the spectrum of what I just described, these are ones that maybe are unique for your environment, that there is no third party that's going to care too much about it, but it's really important for you and your facility. Those are ones that maybe you want to tackle yourself. Or maybe if you've got a research initiative, maybe you've got an investigator that's got a particular skill set in a particular healthcare domain. I know within imaging, for example, there's folks who are very committed to developing new algorithms to enhance, detection of features within some of the imaging modalities. So for those, I think it's unlikely that a small startup is just going to have the clinical background or expertise to be able to do that. And I've seen some organizations really have good luck with developing those things on their own. So I think there's a place for all three of these, and it's fun watching it all unfold before our eyes.
Well, I'm gonna ask one last question here, because as I spent some time looking at these companies, there's some that are incremental improvements and some that are really magical. And I'm wondering, what is the use case that you're most excited about over the next 5 years that maybe doesn't exist, or maybe it's starting to show itself, but you see as having the biggest impact?
Maybe my imagination isn't strong enough, but some of the stuff that we're already seeing, in fact, some of the products that are on the market now are just, it blows my mind, because it's the thing that I hated the most when I would see patients it's not administrative stuff. It's the documentation burden that you've got. Some of it is administrative, but largely it's just recording what it is that the patient said, what you found when you examined them, what the studies showed, and what your plan is, your assessment and plan. I would love seeing patients. I would despise doing that documentation afterwards. Lo and behold, we've got these ambient listening technologies now that do really well at getting that first draft of that document in your hands And initially, these were coming back after human review, 3 or 4 hours later. Now you get the thing immediately after you stop the recording. You get the note within 5 seconds in your EHR. That's amazing to me. That's like, Star Trek come to life. So I think we're already there in terms of my nirvana kind of world. But sure, if I hallucinate a little bit more, not to use the AI related term, but imagine, well, again, not imagine, these technologies are starting to hit the market. Tools that allow computer vision to do things in new ways within a patient camera. For example, I know that there's tech now that can essentially measure the vital signs of the patient without touching the patient, without even having them be, naked or unclothed to a certain degree above the blankets. They could just be in their hospital bed, and magically this camera or radar device at the head of the bed can tell you what their pulse, what their respiratory rate is, what their blood pressure is. I mean, that's insane to me. That's your tricorder, to use my Star Trek reference. And that's just the beginning. I'm sure it's going to get even more sophisticated with time. So we're really in a golden age. You can hopefully tell by my speech that I'm really excited about this stuff. And we're gonna take 2 steps forward and maybe 1 or 2 back as we learn our lessons along the way, and we'll have missteps for sure. But in general, I really see a whole new world unfolding ahead of us, things that are going to allow us to do better for our patients, provide better care, but also do it in more efficient ways that really bring the joy back to healthcare.
Yeah, no, I'm also very excited and bullish for the next decade. And I think there's a huge opportunity to alleviate a lot of suffering. I want to apologize to the viewers. I neglected to look at the questions. There's been a bunch of questions posted. So let me just go through some questions here, which have come from our viewers here. One question comes, let's see, what are your top 3, 4 problems that you apply AI to? I think we talked about that. The other question is, do you have any suggestions? So great point by complementary services being offered by smaller companies. Do you have any suggestions on what functional group or method to achieve this?
If I interpret the question is how should small companies approach healthcare organizations in terms of identifying? Okay, I get the thumbs up for that. So yeah, again, I'll say that this is a little bit tough, right? Because big hairy organizations like mine are sometimes impenetrable. I get it. I am aware of really exciting new startup sort of, I don't know how best to describe them, aggregators maybe, that help to both nurture companies that are just starting out, but also to help present them to organizations like mine, health systems that are interested in a particular domain. So one that comes to mind is Scale Health. They are an organization that helps to present startups to organizations. I believe they do so even outside of healthcare. And in particular, what I'm referring to is something that's coming up at the Chime conference in a few weeks in Arizona, where there's a Scale Health and Chime challenge around workforce challenges within the healthcare environment. And looking out across the field of startups that are out there and helping to present their technologies and the problems that they're trying to solve in various categories related to our workforce. And then to be sure that they've checked all of the boxes that I'm going to check you as the CIO evaluating your company in terms of HIPAA and security kinds of stuff, things that might be a little bit more opaque to startups that are just starting out within healthcare, and they help get you ready, essentially, to be able to answer some of those questions. So I think that's a great opportunity. I think they've got a lot of traction already. Lots of startups are already engaged, but that's an example of one way that you can start to help get your foot in the door and make yourself more visible to organizations like mine. But still, I will readily admit that it's tough, and there's a lot of competition. Again, not to dissuade any of you, but you've got to look over your left shoulder and your right, because it's very likely that over each one of those, you've got another set of folks who are trying to solve the exact same problem you are. So again, this reflects around the speed and the agility that I mentioned before. I think in many instances, the first to market for some of these things, that's going to be an advantage. So a little bit long-winded. Hopefully I answered the question.
Yeah, I know. And, that made me think about the other side of things, and that you're a doctor who's a technologist. And as you move forward with all these AI use cases in the healthcare system, traditionally there's clinical teams who are passionate about the patient perspective, and there's technical teams. I think there needs to be more blurring of those boundaries, and that clinicians, nurses need to start learning a little bit more about the entire process of software development, some of the constraints that exist, the language that's involved, to be more effective in helping kind of co-create those tools versus just disagreeing. Oftentimes it's like something's built, clinical teams like, no, that doesn't work. And it's this kind of difficult relationship. And you've bridged this naturally by being a practicing doctor and a technologist. And I would love to hear your thoughts regarding the future of this kind of workforce.
Yeah, Sal, you bring up a great point, because I'll go back to what I was saying before about some of the startups that we encounter. Frankly, not even just the startups, some of the big players too, is that they fail to take the workflows within our environment, within our healthcare environment, to heart. They fail to touch base with clinical folks who are meant to ultimately use these tools, to ask them their opinion and whether or not they would work or they would be used. So I think getting that clinical perspective is absolutely important. So within healthcare organizations, I think for a while we've learned these lessons when we were starting to implement, EHR platforms, right? Initially, these things were developed by tech-centric people who didn't understand our worlds very well, and we saw the results, right? They were clunky systems that didn't meet our needs very well. I think over the decades, we've learned that lesson, and we now marry technologists together with clinicians much better than we did before. So this is now within the healthcare environment, within the provider environment. But now we need to extend that sort of same set of concepts to the commercial world and be sure that our technology partners who are out there are similarly either employing their own clinicians, and I don't mean clinicians from 30 years ago either. I mean people who are still in the trenches now, who understand what today's problems are, and to get their perspectives and advice on how best to build these things. So in some instances, those organizations, if they've got the financial means, they'll bring them within their ranks, which is great, and we see the benefits of that. But if you can't, and you're just, you've got a good technical idea, well, that's when you really need to make those strong clinical partnerships with a healthcare organization. And that could be small. It could be a small practice, maybe you've got a friend or a friend of a friend who works there, and you could tap them for a little bit of advice. But it could be more formal too, right? It could be a collaborative relationship with the healthcare system, maybe where there's shared equity in the ultimate product. I think forging those clinical relationships is absolutely key to success.
Yeah, I think it's to the last point, it's all about relationships. It's about building that unity of vision and action. This has been an absolute pleasure. I'm really grateful for reconnecting on and having this discussion. Do you have any final thoughts before we end this webinar that you want to share?
No, so I first of all, I really appreciate you having me on. This has been a great discussion. Again, like I said, hopefully folks get through my excitement a little bit that I'm all in on this stuff, and this is not like blockchain was in healthcare, right? Not to disparage blockchain, but there was a lot of hype there, and then not a lot that came out of it. That's not going to be the case here. We're going to see some real impactful changes coming, things that we are going to buy into. We already have from a provider point of view, and I'm really psyched to see it all happen.
Again, thank you again for joining us in the context of the tragedy that's occurring in your community. All of our prayers and thoughts are with everyone in Maine and that region. So thanks again. And thank you everyone who has joined us today for this webinar series.
Thanks, Al.
Take care. Bye-bye.